Hi, this is Shelby from Turn Sounds. If your feet are cold, put on socks.
And Birkenstocks. Hey, I'm Abby, a clinical nutritionist.
And I'm Shelby, a clinical exercise physiologist, and this is the Move Your Mind podcast.
We are sick and tired of people being led astray by false information about diet and exercise.
So join us as we discuss common misconceptions about food and fitness with the latest scientific research.
Let's get into it.
Welcome back, Abby.
Hey, Shel.
Hi, it's been a hot minute.
It really has. COVID just wanted to come on and give us a break. Hey?
Yeah, we had lockdown, we had masks. It's been a couple of weeks since recording. Fun fact, actually, remember the last time we tried to record this episode, we got a decent way in, like 20 minutes in.
And it was really good too. It was really good.
And then our program decided it wasn't going to work anymore, and we lost all the audio.
So Shelby's had 3 weeks to stew on this information. So
doesn't necessarily mean it's going to be any better.
Love
so
it.
as a side note there, if you wanted to support us through our plugged in initiative and feed us just a little bit of money, then we could upgrade our system so that doesn't happen again.
Oh, I
That would
like
be
that.
really nice.
What a segue. She's clever, guys.
So if you needed any extra push, we give you extra content as well. Give us a little bit of money every month, not every week.
Yeah, it is worth it. You get recipes, you get workouts that are tailored for each episode.
And we use the money to make this a better quality podcast. And then hopefully we can earn a little bit so that we actually get paid as well. That would be
I
nice.
know. Not that, it's very much a passion project.
Absolutely. But we each spend hours on this
We do.
podcast each week.
I most certainly do. Yeah.
And now with our jobs and everything, we're not going to stop anytime soon, but it would certainly help.
Yes.
So if you're ever thinking about it, now's the time. Turnsounds.com, you'll see a plugged in button. Click it and follow the links from there.
Plug in.
So today's episode is on PCOS and exercise. So if we rack our brains hard enough, we can remember the last episode that Abby did.
Yeah, I'm thinking about it myself. I'm like, whoa, that was like a month ago.
So we did Polycystic Ovary Syndrome.
Ovarian syndrome. Close
for
enough.
PCOS. And we spoke about pretty much what that is as a condition in itself, and then you touched on nutrition as symptom management and as maybe dealing with actually the effects or the causes, of the condition itself, which is a hormone imbalance, primarily looking at too much testosterone.
Yes.
Yes. Androgen.
Yes. Androgens.
Androgen.
Yes.
Put in
Close.
extra, too many syllables in there.
And the 4 types as well is something that we discussed that's probably important to note for this episode.
Yes, can you rattle those
anticipate.
off for me, please?
Oh, off the top of my head, I've got no
You
notes
can
in front
do
of
it.
me. So we had the insulin-resistant type.
Yeah.
We had the inflammatory type. We had the adrenal
Yeah,
type.
that's the one I remembered too. What's the 4?
And we had the post-pill.
Thank you.
Oh.
I would not have remembered that one.
That was stressful.
So primarily today, the research that I've got to talk about is on the insulin-resistant type of PCOS.
Yeah. Which is the most common. You see about 70% of those with PCOS have this insulin-resistant type.
Yes. And that's why there's so much research on it as well, is because it's so prevalent and because exercise can have a really nice benefit on those with insulin-resistant PCOS, particularly revolving around the insulin-resistant part of that, not necessarily dealing with the PCOS necessarily, but dealing with everything else that comes with it.
Yeah, we discussed that, like dealing with the secondary side effects of the elevated androgens.
Yes.
Is the insulin resistance.
Absolutely.
So by exercise, you tackle the insulin resistant component.
Correct.
And I don't think there's enough research for that effect on the actual underlying pathology.
Yes.
Of
the best I could find, I'm not going to be able to find it straight away. Best I could find was the complex metabolic pathways underlying PCOS are not well understood.
Yeah.
That's the best I could find as far as tying the exercise results back into the condition. There's still a little bit like
and from what I was looking
head scratching.
at, the connection between the chicken and the egg wasn't established. So it's like, does the elevated androgens cause insulin resistance, or does the insulin resistance cause elevated androgens?
Yep.
Or is it kind of like a feedback where they both feed into each other equally? It's not established yet.
Yeah, exactly. But either way, we
Yes.
know some things we can do that make a difference.
For sure.
How that happens is still kind of up for debate, but we know that it actually happens. So that's a good place to start.
Sometimes you don't have to go too deep. My brain struggles with that.
Yeah. Oh, exactly. And definitely for this topic for me, I definitely had to cap how deep I looked because it just got too much. Once we get into metabolic pathways, my brain goes, I ain't so good at this stuff. I don't know.
The fact is there, but the why?
Yeah.
We leave that till later.
So we touched on it as far as the fact that PCOS and insulin sensitivity are then linked with a whole bunch of other stuff. So we know if that's kind of going on, there's a high association with obedience. Not obedience.
Not obedience, a different word.
There's a high association with obesity.
Yes.
And similar but different is the insulin resistance. And then that can follow into type 2 diabetes, issues with hypertension and cardiovascular disease, and just like the follow-on effects of having decreased insulin sensitivity and what that can mean for you.
Just as a recap, decreased insulin sensitivity is a synonym to insulin resistance.
Yes.
Well, I guess high-grade, well, low-grade insulin sensitivity, but high-grade, low-grade, if you know what I'm saying. Like intense low insulin sensitivity.
Yes.
It's pretty much that your body doesn't respond to insulin as effectively. So you've got the glucose from the food you eat. So that's blood sugar wanting to get into your cells. But for multiple reasons, it is unable to because the hormone that transports it, your body's resistant to it, which is insulin. Just for those that are forgetting what these words mean.
Excellent. Thank you. Good on you. And so we know, so this study is getting old now, it's 11 years old, but 50 to 60% of women with PCOS are overweight or obese compared to only 30% of the general population. So more than likely both those numbers have inflated in the last decade, but the disparity would still be there as far as you're more likely to be overweight if you have PCOS than if you don't.
Yeah, and then once again, my brain's just ticking what came first, chicken or the egg. Exactly. And we know that adipose tissue is inflammatory, and from what I discussed, inflammation, systemic inflammation can encourage the female reproductive hormone imbalance.
Absolutely, because that's definitely, so in obese clients, if we're looking at very overweight clients with PCOS, you can have effects on, so you are able to restore ovulation and affect pregnancy rates. And last time when we talked about this, that you guys will never get to hear, we had to ponder that for a little bit. And what we kind of found was, yes, it's because of the adipose tissue affecting the sexual hormones.
Yes.
And that's why the weight loss made a difference in ovulation rates, is because you had less of that adipose tissue that is changing the way your body works.
Yeah.
So you can, just by losing weight, can improve practically every parameter of PCOS, from the reproduction side of things to getting better at dealing with insulin to so this is where I will admit that my understanding is limited, because it can have an effect on lowering testosterone. Which is obviously that kind of primary thing that's going on in PCOS, but I don't necessarily know how.
So exercise affecting testosterone?
Yeah, a weight loss.
Oh.
So I guess that's the adipose tissue story.
Yeah.
And then I guess exercise is your avenue to weight loss.
To reduce adipose tissue, which is obviously affecting testosterone in some way.
Yes.
But what you're saying is you're unsure.
I'm not entirely sure about and that's me personally. There might be a few more answers out there that I haven't
That's my homework.
Looked into. Cool.
I'm interested.
So yeah, definitely. And then just like can't disregard the psychological benefits of losing weight and therefore feeling better on your quality of life living with PCOS.
And as a reminder, this is population that's overweight.
Yes,
so if
obese
you're the
even.
30%
Yes.
that doesn't have weight issues and has PCOS, don't think that you have to lose weight.
No, definitely not. This is all in those where weight management is needed.
Okay.
Yeah, because we know also that the insulin sensitivity is worse in obese PCOS than lean PCOS.
You mean the insulin sensitivity is lower?
Sorry, lower. Yeah.
Yes,
Yeah.
yeah.
Yeah. So PCOS, the insulin resistant type of PCOS, they all have it. Those who are overweight have worse symptoms than those who are lean.
Yes.
So that's like directly correlated to adipose tissue, plus whatever else is going on that we don't quite understand yet.
Yes.
Yeah?
Yeah. Makes total sense.
Yeah, it does, doesn't it? So a lot of the research is done with aerobic exercise. And then I had another and I had another secondary search for resistance training and PCOS, and there is much less out there.
Which would have hurt you?
I know it did.
Resistance training.
Yes. So the most I have are kind of a few pilot studies and some meta-analyses that say we need more.
Yeah.
Because the ones that have been done haven't factored in diet or nutrition or anything like that, so they're not amazingly good quality. But we do know in the work of type 2 diabetes, which has very similar outcomes that we're looking for, that resistance training in conjunction with aerobic training is really, really good.
And that's something important to note. I think the fact that there's not evidence doesn't mean it's wrong. It means it hasn't been researched.
It just means we haven't found it yet.
Yeah.
I don't usually say that about a lot of things. I don't like retroactively researching things.
Yes.
But when we have enough evidence for resistance training with everything else, I'd be pretty happy to say.
Yes, because it's, as you said, it's the same outcome.
Exactly. And if our outcome here is lowering fat mass, resistance training absolutely has a role in increased muscle mass, lowering fat mass, which would absolutely have an effect on testosterone levels.
Yes.
So that's where I'm like, yeah, come on. Just because we don't have a very specific study looking at insulin resistance and resistance training in PCOS individuals doesn't mean it can't happen.
Does somebody want to fund a study? I'm happy to take part.
Are you happy to put your hand up to do that?
I'll be co-author.
Amazing, good. Come on, someone reach out, help us look into that.
We need more. We need the evidence.
So definitely most of what I'm talking about today is aerobic, exercise related, and that's all I have to say about that so far.
Okay, cool. So aerobic, reminder, is utilising oxygen.
Correct.
So examples, walking, jogging, swimming, cycling.
That's pretty good. Any more of the repetitive movements will be aerobic, because then you could even chuck in like your rowing machine and stuff in that cross trainer, things like that. So more of your repetitive movements that get your heart rate up.
And like steady state. That's how I like to think of it. Like you've got a steady beat and you can, well, depending on the intensity, kind of hold a conversation, probably out of breath a little bit.
Exactly.
But it's not the hit.
Yeah.
It's not hit. It's not.
Not necessarily. It can fall under that. And I think there is some room for that kind of research as well.
Yeah.
Because definitely in type 2 diabetes, there is some really cool things about HIIT, aerobic training.
Yeah.
Which is then
that
hitting a few different training systems at the same time, isn't it?
Yeah, that's always something that interests me a lot, because I'm just coming from the inflammatory perspective. So I'm like, high intensity interval training does increase like inflammation acutely as a response to the exercise. I was just about to say short term.
Yeah.
So the long term effects of that, that's always a kind of decision I make in my mind when I have clients with PCOS.
I could definitely reason like anything else if you put yourself in that situation, you'd get better at dealing with it long term. So you would definitely get more efficient at dealing with that stress.
But it's whether or not your systems are robust enough to deal with the acute stresses.
Absolutely.
At that point.
Yeah, because definitely we've had that, and you've made me think differently about some of my. Definitely, I had a PCOS insulin. Well, she turned out not to be insulin resistant. Anyway, we had a PCOS client. Who was doing all these HIIT classes and doing this and doing that, and then it wasn't until talking to you that I was like, I think we're doing too much intensity. There's a little too much stress going on here, so we pulled it back.
Yeah.
But yeah, so PCOS working to reduce insulin resistance. Sorry, exercise is working to reduce insulin resistance, particularly even just the aerobic. So even though resistance training can have really cool benefits, if you just do aerobic training, you can get some changes.
Yeah.
So this one found a normalization of insulin responses in patients in just one session. So one session of aerobic exercise, which was 60% of VO2 max, so like moderate, not very high intensity, for 1 hour. And they had differences within that one session, and then across the 8-week study, they definitely had benefits in mitochondrial fatty acid oxidation.
Okay.
What does that mean to you? Moderate intensity exercise. This is the one that then says complex metabolic pathways underlying PCOS are not well understood.
We don't like
So
it.
this is the one that kind of, this is where I lost my head. That's why I'm getting confused now. Is because it talks about insulin resistance, and it also talks about fatty acid oxidation, and it also talks about accumulations of fatty acids, and this is where I kind of went.
So it seems to be exercise and energy production pathways, maybe not isolated to the utilization of glucose.
Yeah, okay. Yep.
Because fatty acid oxidation is utilizing fatty acids.
Yeah,
through
which
a
would
different pathway.
make sense at that lower VO2 max intensity,
Yeah.
right? So if we are working at 60%, which, like I said, is moderate intensity kind of at best, then you would be utilizing more of your fat storage, I say, in little quotation marks. Yeah.
I wonder if then, the fact that the mitochondria is more effective at beta oxidation with the metabolism of fats and the breakdown of, well, not the breakdown of fats, but the utilization of fats, whether or not that equates to overall effectiveness of the mitochondria.
Yeah.
And we know that they also uptake and utilize glucose.
Yeah, so what we're looking at there is just efficiency of your whole system. And then this is where we get to the, I don't really know what's going on, but
The
do it
rabbit
anyway.
hole.
Do it anyway.
Yeah.
So that study, just for if we were going to implement this into anyone's lives, was 1 hour 3 times a week at 60% of VO2 max, which, like I said, is about moderate intensity. So you'd probably be able to talk the whole time, but you wouldn't be able to sing or anything more crazy like that.
Who really sings when they exercise,
don't
except
know,
for Beyonce?
They're hardcore athletes. Yeah, exactly.
I 100% agree.
So we know that the exercise did improve the cardiovascular fitness in these individuals. The glucose disposal rate improved.
Yeah, see, that's important.
Yep.
Yeah.
And then this is where they're saying maybe because of mitochondrial capacity and the improvement of glucose transport through a few different hormones into the muscles.
Yes.
Because that's why I found this one really interesting as well, because we started off the episode saying if you can just lose weight, things will get better. This one, they didn't lose weight. They just got fitter and they had benefits as well.
Yeah.
So here's where it becomes really fun being a clinician with all these, like, do I need to lose weight? Do I not need to lose weight? Should I focus on it? Should I not focus on it? Because you can kind of, it seems you can get benefits either way.
But I kind of like that in a sense, because lots of people might start exercise for aesthetic reasons or will adopt a new dietary approach for aesthetic reasons, and it's showing that you can do either and not lose weight but still get benefits. So it shows it's deeper than appearance, I guess.
Exactly.
In another perspective.
And then this would have been one that didn't accommodate for nutrition either. So if you did do this nice 8-week thing, and see, they're only doing aerobic training. If you did this 3 times a week aerobic training, which is very reasonable, added in your 2 resistance training to get your muscle mass kicking, added in basic nutrition changes, and you'd get a very healthier body after just 2 months.
Yeah.
And then the fat loss comes at a slower rate anyway, which is really what we're looking for. We don't want a rapid decrease in weight because it usually means other things being lost and not fat.
Yes.
So I'm after the slow and steady approach.
Oh, definitely.
Anyway, so I'm not that mad that in 8 weeks you haven't lost too much weight.
Yeah. No, I totally agree with that.
Yeah.
We talked about that, the kind of weight loss situation. What are you actually losing in terms of muscle mass or fat mass? When was that?
Did we really?
Yeah.
'Cause that's a good topic.
I like that episode.
Yeah.
I think intermittent fasting, that's what
probably.
it was.
Yes.
Talking about.
Because we're talking about how quickly it was coming off.
Yes.
Yeah. Yeah, definitely.
Yeah.
I'd like to do a BMI deep dive in an episode.
Cool.
Yeah, and just talk about whether we should be measuring body mass index. And then along that lines of it matters what you're composed of.
Oh, yeah.
Yeah, definitely.
Cool. Like that.
Another one I found was more on the autonomic function and inflammatory patterns in women.
Now you're talking
yes,
my language.
Now this is why when I saw this one. Again, it's a little bit old, 2008. But things like this is where I get with older studies. Like that stuff will still happen in the body. You know, just because it doesn't stop happening just because it's been 10 years later, but it just means we could probably explain it in a little bit more of a refined way now than the study did.
I found that a lot with the episode we're about to record for me.
Yeah.
Old studies, and it seemed to have just disappeared. Like there was a thought pathway, like this is showing this, and further studies are needed. And then I was like, where'd it
go? Everyone just forgot about it.
Yeah,
exactly.
Like, can we?
And that's sometimes the thing. Like you'll get a really good study that showed really good things. And so while there still are gaps, people go, like, you know, it covered everything. And so they look for the bigger gaps. And so it's exactly that. It never is followed up because it's like that was probably answered well enough.
Yeah, tick.
And then the years go by and all of a sudden it's a 13-year-old study and you're like, oh, I'm not really supposed to use this anymore.
Yeah, rules.
Exactly.
What?
So again, this one was looking at cardiopulmonary function, so the function of your heart and lungs, and that's from like a fitness perspective as well, and insulin sensitivity markers in PCOS women. So we know that they show an impaired inflammatory pattern. So they have like an increased response, which would go hand in hand with the increased adipose tissue, because adipose tissue is inflammatory as well, although this one didn't necessarily remark on their weight that I noted anyway.
So what was the population?
Women with PCOS.
Okay, so there was not with obesity or overweight like the previous one? No, okay.
Yeah, because it had more to do with the inflammatory markers as well. We just know that majority of ladies with PCOS are overweight.
Yes.
Or with, you know, the type that we're talking about. So this one became a study because apparently your heart rate recovery can be related to inflammatory markers.
Oh, wow.
Yeah, which I hadn't ever considered.
Yeah, no.
So the quicker your heart rate returns to normal after an exercise bout is usually a nice sign of fitness. We want you returning to baseline quite quickly, or like your resting heart rate relatively quickly. So what they're finding, or what they were saying in this one, is that that recovery time is also linked to inflammatory markers. So this one looked at just getting fitter, and then that's having an effect on the inflammatory pattern expressed by these ladies.
That's really interesting, actually, the inflammation and heart rate.
So this is where we got into vagal nerve activation, which I think is about where we cut out last time, because I remember going, okay, I've got to be careful how I tread here because it is on the edge of my understanding.
Yes.
So then this was tying in autonomic function with inflammation. And so they were looking at vagal nerve, which for those listening is just a bit
So
crazy.
autonomic is a division of your nervous system that has sympathetic and parasympathetic.
And autonomic is involuntary.
Yes.
So we're
so
not
you
in
don't
control of it. Yeah.
And then we discussed this, the vagus nerve, its fibers can dictate if you're predominant with your fight or flight, your sympathetic nervous system, or
Correct.
your parasympathetic nervous system, which is like rest and digest.
Yeah. And how excited that nerve gets is going to affect that.
Yeah.
So being... Yeah, this is where I'll probably stop talking to all those listening if you need. Well, this is where I get, because I'm pretty much just reading what the thing said because I've got a limited understanding of it. So it says, exercise-induced improvement of autonomic function as expressed by heart rate recovery and inflammatory patterns in young women. So that was looking at white blood cell count and C-reactive protein levels.
Yeah.
Then it says that the vagal reactivation mediates the rate at which heart rate recovers after exercise. So your vagus nerve being active pulls your heart rate down. This is where I don't remember off the top of my head how they interact with each other.
Yeah. Yep. Because, vagus nerve, because we know that through things like deep breathing and even like gargling, if we're going naturopathic,
Yes,
that can stimulate parasympathetic
Parasympathetic, which
system.
would bring you back down to resting.
Yeah, so that's the activation. Oh, yeah, and remember, sympathetic nervous system overactivity results in reduced vagal nerve tone.
Yeah,
remember that?
Okay, yep. So we want this nerve to be active to return to resting.
Yeah.
Cool, all right.
Makes sense.
So that's what it's saying, which makes sense. So the quicker your heart rate recovers is telling us a little bit of a story about how active your vagus nerve is.
Yes.
And then how active your vagus nerve is telling us about your parasympathetic nervous system, which is telling us about your response to stress, which is telling us about the inflammation.
Oh, yes, Shelby, that is, you absolutely nailed that.
Thank you.
That was great. That was so good.
So this is the kind of like, this is how deep this research goes, is because it's not like A equals B, it's A equals B, therefore C, but maybe D. But then if you backtrack, it's E. And you just have to like draw all these conclusions yourself.
Well, I think the way you just explained it, there's a pretty even...
That works,
There's a
didn't
linear
it?
A, B, C, D, E.
Yeah, all right, cool, I like it.
And that makes total sense, though.
And then a little bit easier to understand is that we know, like I mentioned before, that the heart rate recovery is linked to fitness and cardiovascular health. And so if you, like we said in that study just before, if you just get fitter in your cardiovascular system, you will have improvements in the efficiency of your system, which will help your symptoms of PCOS.
Yes.
So it can kind of be that easy as well.
Yeah. It's often like that.
Or we can think about the vagus nerve if you want. I don't know.
I like thinking about the vagus nerve.
Lovely. And then the last one I wanted to mention, because I'm thinking it's more our demographic, was looking at exercise and sedentary habits among adolescents with PCOS. So looking at kind of the teenagers running into very early, heading into 20s. So girls with PCOS participated in physical activity less than their controls who didn't have PCOS.
Okay.
So that's not a good setup as far as not getting obese, not getting type 2 diabetes, not getting heart problems, is if you're not even active enough as a younger girl, those habits aren't being formed to lead you into adult life either.
And it's hard. I'm just thinking holistic picture. You can imagine a young girl with PCOS, usually symptomatically pain, fatigue, exhaustion. If it's insulin resistant type, you're not going to be uptaking glucose, i.e. fatigue.
So it's harder for you
to exercise, but then the more you feed into that feeling, the worse you're going to put yourself for future. And that's why it's so hard. Like, I really do empathise. Yeah, sympathise. Yeah.
And that's pretty much what we were looking at. It was just like an observation study that, if you had PCOS, you were less likely to exercise even from a child and adolescent time frame.
Yeah.
And their time spent sitting was much higher, which absolutely increases risk of obesity and all the other lifestyle chronic diseases that you are at more of a risk of just because you have PCOS as well. So very important to find some kind of movement strategy that you like and that works with you.
Yes.
And hopefully, like I've demonstrated, it can be aerobic. It can probably be resistance training.
Yeah.
Mix of the two is nice. And you've got the whole world under your feet as far as what that even looks like anyway.
Exactly. Yeah. Remove the barriers because the studies are showing it doesn't have to be extensive.
Exactly. Yeah. So, these studies were from walking to swimming to aerobics to cycling. Like, it doesn't really matter.
Yeah.
And it doesn't even have to be that. If you like surfing, if you like rollerblading, whatever you want. Yeah, exactly. Like, just go out and do something.
Yeah.
And then we can start to talk about the benefits of being social and the benefits of being outside and things like that that you're then also tapping into. So
vitamin D for immune function feeding into the inflammatory system.
Absolutely. Definitely. Do it. So, how's that?
Good.
That's pretty much my talk.
Yeah.
Yeah.
Shelby's TED Talk.
Please no. If we're going to listen to me, let me talk about something else. Something I'm a bit more comfortable with.
No, that was good.
It's good. It is always good to put yourself out there and research something that you wouldn't necessarily look into.
Definitely. No, I enjoyed that a lot.
Yeah, good.
It's
cool.
just, it's reminding everyone, including myself, you hear exercise is good, food is good, but this is the facts. Yeah. Like, there's A to B. It
actually does something.
Yeah, it actually does something.
Absolutely.
It is a treatment strategy.
Yeah. And then, and it's affecting the things that you have no control over otherwise, So, like, there's, people love to sometimes put it on like, oh, just be happy or just meditate or whatever. But, like, these are actually changing the things that you can't change just by yourself. Do you know what I mean?
Yeah, it's gonna feed in. Well, the way I'm thinking about that is that, just be happy. So some people can be like, oh, I don't like exercising, so if I don't exercise, I'll be happy. But we know that if you do make that step to exercise as part of a management strategy, we know its effects on mental health.
Yeah, exactly.
And even practicing discipline and doing something that's good for you, the widespread effects of that.
Mm-hmm.
I was actually talking to my boss today at my Pilates studio about how mental health versus muscle health and how we train our muscles and they grow. And mental health is the exact same thing. You have to train your brain. You have to train your thought patterns for positive mental health outcomes.
Absolutely.
And I think that's a great reminder, because that discipline and that step going, I need to do this because it's going to make me better, that's training a lot more than a muscle.
Yeah.
And I like that.
We had this talk at work on Thursday.
Really?
We have like these round table things now, and we were talking about mindset and just the benefits of doing exercise relating to a better mental health because of the benefits it has for mindset and for believing in yourself and for sticking to something when it's hard and all those beautiful things that we can get good at.
Love that.
Cool.
Thanks, Shelps.
No worries. Thanks for listening. I'm glad that we got it done.
Imagine if it cuts out.
I wouldn't have done it.
Stop it now.
Thanks, guys. See you next time.